Hi, hello everyone. Welcome to Dr. Ravichandra Official. Please like, share, and subscribe Dr. Ravichandra Official for more interesting videos on your pathology subject. Okay. In the last video, we have discussed about necrosis, which is a type of cell death. It is an example of irreversible cell injury. When a cell undergoes injury or when a stimulus is given for the cell to get injured, even after the removal of the stimulus, if that injury persists or continues, it is irreversible cell injury. And if the cell reverts back to the normal after removing the stimulus, then it is reversible cell injury. This everyone knows. Okay. So irreversible cell injury is occurring in the form of two parts. One is necrosis and the other is apoptosis. Both are cell deaths only. Necrosis is, you can say in a simple way, unprogrammed cell death, and apoptosis is a programmed cell death. In apoptosis, we the process will be enhanced with the help of caspases enzymes. So it is a caspase dependent programmed cell death. Apoptosis is both physiological and pathological process, but necrosis is a pathological process. Apoptosis examples: embryogenesis and Councilman bodies in viral hepatitis are classical examples. Apoptosis has an initiation phase and an execution phase. Initiation phase is promoted by caspases 8, 9, and 10, and execution phase is promoted with the help of caspases 3, 6, and 7. In the initiation phase, it is further subdivided into two pathways. One is intrinsic pathway and the other is extrinsic pathway. Intrinsic pathway occurs within the cell, that is in the mitochondria, and the caspase 9 will act a key role in this pathway. Coming to the extrinsic pathway, it is also called as death domain pathway, and it occurs outside the cell at the bilipid layer. Okay, there will be FAS ligands. All these FAS ligands will combine to form FADD, and this FADD will result in death domain pathway. The caspase that is helpful in this extrinsic pathway are caspases 8 and 9. So initiation caspases are 8, 9, and 10, and execution caspases will be 3, 6, and 7. Apoptosis is promoted by few, and apoptosis is inhibited by few family members. So BCL2 and BCLX family members will be acting as anti-apoptotic genes or anti-apoptotic members. Okay, and Bax bad DIM will be acting as apoptosis promoters. The marker for apoptosis is annexin 5, and the molecular marker for apoptosis will be CD95. If the cell death occurs not based on the caspases, that is caspase independent cell death, then it is called as necroptosis. Examples are growth plate formation and steatohepatitis. Here, no caspases are involved in this process, but procaspase 8 will helpful in necroptosis. Coming to pyroptosis. In response to Shigella, there will be activation of an inflammasome with the help of the caspases 1, 4, 5, and 11, and the interleukin 1 will be getting activated. As a result, there will be fever. This condition is called as pyroptosis. The necrosis and apoptosis can be differentiated with the help of PAGE, polyacrylamide gel electrophoresis. If you see the picture, you will be observing the black color three graphs. One with the arrow is normal, first one. Second is in the form of step ladder pattern, and the third way is smearing pattern. Stepladder pattern and smearing pattern both are seen in apoptosis and necroptosis, but smearing pattern is more common when compared to stepladder pattern is more common when compared to smearing pattern in apoptosis, and smearing pattern is more common when compared to stepladder pattern in necrosis. So stepladder pattern and smearing pattern are useful in differentiating the necrosis and apoptosis to up to a certain extent. Thank you for patient listening. Please like, share and subscribe Dr. Ravichandra Official for more interesting videos.